very effective tool. It's light. Okay, so we're just gonna adjust your neck. And it's a very gentle adjustment. Just relax your shoulders. Good, same thing, just relax your shoulders. Good. When you get adjusted, it resets what are called mechanoreceptors or proprioceptors that are on the ends of the, where the muscle spindles meet the joint. It helps the muscles and joints reset, prevents arthritis and scar tissue, which will definitely happen if you have an whiplash injury. You absolutely don't want to just take medication for it because you're going to feel better, but under the surface, you're going to be left way worse. So the smart thing to do is to get adjusted. We have a digital x-ray system here. We can take x-rays. All our offices have digital x-ray, or have x-ray. One more this week. Just let you think up. Perfect. So a little extra to get that. Slide down towards me. Oh, you're good. I got you. Real light. Oh, shoulder. One more. Nice. Okay. And a little bit of traction here. Let me grab a towel. A little light traction. Good. Nice and easy. Let it drop. Look at that. You okay? Mm-hmm. Good. Okay, so that's basically it. Kind of keep it short and sweet, but it's going to help. Again, all things I talked about, prevent injuries and prevent chronic problems down the road. Last thing you want to do is end up a year or two down the road from a car accident and be in terrible shape, and then you can't open a claim at that point because you have to do it right away. And this one. Oh, perfect. Okay, thanks.